Hi, everyone. My name is Sonya Bohmann, and I am the Executive Director of the Construction Industry Alliance for Suicide Prevention. You are listening to Above and Below, our official podcast. I'll be your solo host today. Typically, Zulk Malik joins me, but I am running solo. And today, my guest is Cal Beyer, the incomparable Cal Beyer. Cal, why don't you give us a little bit of background, please?
Hey, Sonya, it's great to see you. I love the energy you bring to this mission. I've been in this space for a long time, as you know. I now work for an organization called SAFE Project. We're also a 501(c) nonprofit, and we're committed to the addiction epidemic in the United States. So we were founded in 2017 by Admiral James and Mary Winnefeld after they tragically lost their 19-year-old son due to an opioid overdose. SAFE Project works in 4 areas to address the interface between mental health and substance use disorder. We focus on education of stigma, overdose prevention and response, and we work on development of prevention and recovery programs. So those 4 initiatives are safe workplaces. I'm the senior director, safe campuses, safe communities, and safe veterans. So it's been
I love those connections. That makes
really
a lot of
cool interface. It makes for system-wide change driving, powerful and impactful.
So this is such a huge conversation. Obviously, we focus on suicide prevention, specifically in construction, so the workplace sort of bucket that you were talking about. But you and I have had lots of conversations about this intersection and how these two things sort of connect in a lot of ways. And we've also had a lot of conversations about substance use and substance misuse and sort of the whole elephant in the room and how these things go together. Tell me a little bit about that.
Sonya, I've been working on this since a long time ago, 1992 to 94, as a risk management professional. Why are people attempting suicides in jails? So I brought the issue to the forefront. And it was shocking to individuals, including the law enforcement community, that this was happening. It led to system-wide change in my home state of Wisconsin, where recruits were trained differently on behavioral health. And it led to some funding allocation changes. Shortly thereafter, I felt called to the construction industry, moved from Chicago to the East Coast, and all the work I'd done with public safety for the prior 8 years and in healthcare prior to that when I was in high school and college came to the forefront when 9/11 happened. And we never really talked about moving this upstream to address substance use. You know, there was no data in suicide prevention until July of 2016.
Right.
But when the data did come out, that proved what Dr. Sally Spencer Thomas, Bob Vanderpoel had been saying, that we felt construction was a high-risk industry. It was my observations, their experience, that led to that conclusion. I almost began immediately addressing this intersection of substance use, mental health, suicide, and then sadly, overdose prevention as well. So it's the elephant in the room because we don't have the conversations at home and we don't have them in the workplace. We think someone else is going to have that conversation. And it's where we were in 2010 to 2015. We were learning that there might be a challenge, that there might be issues, but there was no data to prove it. In this case, there is data, but we're still ignoring it. We don't know how to address it. And there's a lot of things that we need to think differently, but it's how do we help people? Because we have safety-sensitive positions, we have drug-free workplace policies, and we have drug testing protocols. And that does become a barrier.
So I talk about suicide prevention all the time. And the one question that comes up more often than probably any other question is, well, how do you create those conversations or those policies, and who should be having them around how substance use or misuse fits into the conversation about mental health, and who's allowed to have it, who's supposed to have it, who's not supposed to be having it? Like, where and how does this fit?
Sonya, I grew up in a family when I was 12. My parents sat me down. We had a conversation about mental health and substance use challenges on both sides of our family tree. It took me another 6 years to find a classmate whose parents had had that same conversation. So I was fortunate. I had that conversation before I had the birds and bees conversation. So it shows this works well if parents embrace their role as a protective factor. And each, well, the challenge is this impacts so many families. The prevalence is very high. And
Yeah.
so until we are comfortable treating this as a conversation, it's going to continue to be uncomfortable. So we need to break the stigma, much like we did with mental health and suicide prevention, and to recognize everyone has a role to play in substance use prevention. I'll tell you one thing that is really positive. There's data from the Gallup organization that points to a seismic shift in alcohol. And I'm really excited because it's giving us an opportunity to talk about this much more openly. So Gallup has been talking and surveying America since 1939 on drinking behaviors. And this current study in their survey showed a record low of 54% of Americans reported drinking. It's the lowest level. So that was really positive. That was an 8% decline over the 2023 poll. And many people aren't aware of this data. They're not tracking it like I've been tracking it. This has been continuing a decade-long trend. Younger respondents are reporting lower rates of drinking alcohol. So today, it's 50% of those between 18 and 24 reporting drinking, compared to 56% those over 35. This is an opportunity with our workforce development opportunities in our apprenticeship programs to double down on the prevention. And I think using the health effects data from the Gallup polls is powerful as well. Today, a majority of Americans feel drinking is unsafe. And Sonya, that led to me
Interesting.
make a decision August 16th, 2024, to finally go alcohol free. I felt I could be
Wow.
a more effective ally
Mhm.
and advocate for recovery if I went through that decision making myself. And over a couple year period, I did something called moderation management. I didn't go
Okay.
abstinent at first. I was moderating my expectations and my understanding and relationship with alcohol. But I think this is an opportunity. Use this Gallup data to bring knowledge to the workforce. We all should think about alcohol awareness as one example of addressing substance use.
So that's so interesting to me. So anecdotally, I have an almost 21-year-old. She will be 21 this coming week. And it is such a different perspective from her friends turning 21 than just going back a little bit in time to when I turned 21 and what that experience looked like. It's not so ingrained in that culture. It's not this big moment like we built it up to be. And it's not even as much of part of their sort of experiences as we had to be. Mocktails are so prevalent in colleges, and it's just I'm almost shocked by it growing up in the world that we grew up in that age bracket. But tell me a little bit about you said you were, and tell me the exact terminology, you moderated your consumption initially. What does that look like? And what's that feel like?
So I used an app to
Oh,
give me some education, have availability to a coach. And the app
okay.
allowed me to track my consumption, and it required me to set a weekly and monthly goal.
Hmm.
And it allowed me to evaluate what my usage was and then what days were more prevalent to see if I could identify what I call behavior modification. I didn't
Patterns, yeah.
start with the goal of going to zero because I enjoyed socially drinking. I love to watch a basketball game or a hockey game and have a cold beverage.
Sure.
But The closer I got toward retirement age, I thought this is a slippery slope. I could do that more nights when I'm retired,
Sure.
might be healthy for me. So while I was moderating my consumption, I was really researching the health effects. And I felt for myself,
Mhm.
I needed to make those changes for my future health preservation. And
Mhm.
I was really happy I did so. I got to a point, Sonya, where my alcohol consumption was down to 2 drinks, 1 or 2 days each week. And then I got it down to 1 drink once a week. And I was thinking about it too much. Which day was I going to have that 1 drink? And if
Oh,
I
wow.
to be Friday on my app, I was out of plan if I did it on Saturday or Thursday. And one night I said to my wife, it would be easier for me to just stop altogether. And I
Mhm.
did. And the app really allowed me to reinforce the decision I was making, to get the positive reinforcement. I was able to share comments and my experience with others. And that gave
Mhm.
me a sense of being a helper and being an ally and an advocate and
Mhm.
letting people know you can do better next week. And here's a technique I use. This is what I've done. Have you tried this for hydration? So, Sonya, there is a program called moderation management. It doesn't require abstinence. It allows you to evaluate that relationship with alcohol and then to make intentional, informed decisions. And it worked really well for me.
That's awesome. And I think that it really, we talk a lot in this place about shared stories and the power of shared stories, and being able to have that experience to share with others goes a long way. So kudos to you for being a year sober.
Yeah. And Sonya, I had experience as a teenager with
Mhm.
opioid prescription pain
Sure.
medication
Yeah.
use, misuse, and abuse. And the most valuable lesson I learned from that is one, this can happen to anyone, and that it
Mhm.
is a slippery slope. I also learned never judge, but most importantly, I learned how to seek, ask, and accept help.
Awesome.
And I was very, very fortunate. I
Mhm.
had a doctor, an orthopedic surgeon who was hardcore, who really challenged me. Do you really want to get better? Yes, sir. Are you willing to help me if I know that you're committed to making this right? Yes, sir. Um, I think today it would be treated a little less harshly. I think he was disappointed that I had taken advantage of his care to refill prescriptions beyond
Mhm.
what my real need was. But I've learned a lot, and that was almost 48 years ago.
I think it's education, right? And how we are educating within the workforce, even doctors, on how to have these conversations, how to provide that support. So, what does that look like? What observations do you have in how we can make those conversations more prevalent? I don't want to say easier, but easier, less stigmatizing in the workplace.
Like to me, Sonia, we have to be able to have the conversation when it's necessary. The best way to do that is to have the conversation with everybody, much like we've done with mental health and suicide prevention. We can do toolbox talks. We can do stand downs. We can share information with people about substance use. Let
Mhm.
people know the resources that are available. We can build a network of community based resources. There are resources available at many city health departments, county health departments, community recovery organizations with peer support specialists. So we've been afraid to do that because we're afraid how our employees are going to respond.
Mhm.
Folks, we were there 10, 12 years ago on suicide prevention. One of the barriers that held us back was, what are our employees going to think? I
Mhm.
believe your employees will thank you for having this conversation. So, Sonia, one thing I wanted to say right off the bat, and I didn't. September is not only Suicide Prevention Awareness Month,
Right.
and it's the month where Construction Suicide Prevention Week occurs.
Mhm.
It's also Recovery Month.
It is.
And when
Yep.
I look at how far we've come on suicide prevention, we're at about 99%. of all social media this month will be focused on suicide prevention and about 1% on the recovery side.
That's a great point, Cal. So, one of the things that we decided to do is because both conversations require and deserve so much attention, we're actually punting our conversations for Recovery Month into October so that we can give it the due that it deserves and have real conversations and spend real time bringing awareness to the conversation.
Yeah, you were intentional about it and you were
We
strategic.
tried.
And we all know this momentum wave, we're going to ride that. But what I've been trying to do is have the both and conversation. It's not either or. There
Absolutely.
is data that points to persons who use alcohol are more likely to die by suicide. Persons with alcohol use disorder are more likely to die by suicide. Persons who use substances and those who inject substances die more frequently by suicide. And there's the uncertainty on that connection between what percent of overdoses may have been intentional versus unintentional. I don't want to get lost in those numbers because it's human lives. One is too
Right.
many. So similarly, we need to destigmatize. We need to think about prevention, treatment, recovery, and then we need to be bolder about harm reduction in workplaces. And we're
So, let's talk
seeing
a little bit about that. Tell me what you mean by that.
So we're seeing some real shifts on the willingness and availability to stock naloxone in workplaces, also known as Narcan, the brand name
Sure.
of that product. For many years, people weren't sure if the benefits of naloxone outweighed what they viewed as the risk. And it turned out a lot of stigma was driving why people weren't doing this. The stigma of, is it going to encourage drug use on a job site? Is it going to make us seem like we're speaking out of both sides of our mouth? What people recognize today is overdose does happen for many different reasons, and we should be prepared. Harm reduction is the practice of different disciplines to save lives. And we do it in seatbelt usage. We do it with fall protection, arc flash
AEDs.
protection,
Yeah.
AEDs. We do it with sunscreen.
Right.
So it should be a natural that we're prepared. So that evolution of first aid training then expanded to CPR, then AEDs, then stop the bleed. And today it also includes Narcan or naloxone training for the reversal of overdoses. So it's a real positive trend.
It's so, when you lay it out like that, it's so obvious. But why are people still afraid to have Narcan in their first aid kits? Why is that stigma or that putting on your risk management hat again? Why is that such an issue for people? I know I've talked about it when we do our presentation. I carry it in my bag now because of you, obviously. But people are like, oh, no, we can't get approval for that. Why?
A lot of
Get
it
it.
has been concerns about liability.
Okay.
What if something goes wrong? What if we make an attempt and it doesn't work? And we have to view this as an emergency preparedness method.
Sure.
And then it's an emergency procedure
Yeah.
and have a backup plan and have the contingency plan and understand the Good Samaritan statutes that are in place to provide that protection. If anything, it's going to become a consensus industry standard where more organizations are going to be willing to do this because they recognize the benefit of being prepared. So what I've been doing is educating people. Okay, let's try both scenarios. Let's try your scenario of not having it on site and not having someone trained versus my approach, having it on site and having someone trained. So then we go through their scenario first. Okay, so no naloxone. What happens then? Then what happens? Then what's the likely outcome? Now let's go through my approach. Which feels more professional? Which are the employees on that job site going to accept? What happens in your case if you don't have it? Are people going to chirp and say, for $50, we could have saved that life? How are we
Right.
not prepared? You're going to end up losing an entire day of your operation and your focus of your employees. And what happens many times, Work will shut down that day. People will get sent home and, hey, we'll come back tomorrow. They haven't forgotten that happened yesterday. In the
Right.
scenario where you have naloxone on site and it's available to be deployed because you have people trained, people will recognize the signs and symptoms. They'll
Mhm.
take the immediate first aid steps. They'll initiate the 911 call, administer the naloxone. And
Mhm.
by the time that emergency response has come, maybe you've needed a second dose, maybe not, but most likely that person will have been successfully revived and transported off site and
Mhm.
work continue. It was like another incident, and it
Right.
doesn't have to be stigmatized.
Mhm.
We can have a success, and all of us can be proud of that. I'm seeing some real large companies boldly take action. And last Friday, I heard from a company that made a commitment to do this on 1,100 projects by January 1st. It was
That's
huge.
amazing.
And
That's amazing.
well, several months earlier, a large
Mhm.
mining company, a Fortune 500 mining company, put it at 550 operating facilities. And
Amazing.
those successes of adoption are having people rethink, we can do this.
Right.
So be bold, like we've done on mental health and suicide
Mhm.
prevention.
I love that. So I'm going to ask you to make a shameless plug because this is how I learned how to administer naloxone, but you guys have some really great training options on your website. So talk us through a couple places where people could get that if they wanted to learn how to administer naloxone themselves.
Yeah, and I'll share with you for your program notes the
Yeah.
actual links.
Hmm.
There is a video in English and in Spanish that was done in conjunction with the National Association of Home Builders and the Job Site Safety Institute and Safe Project. It was before I came to Safe Project and was just a partner to Safe Project, but I saw the work that they were doing. The fact that it's in English and in Spanish is being embraced. People are really starting to increase the
Hmm.
uptake on those videos. We also have on our website a 5 minute and a
That's what I'm
30
thinking of.
minute version of
Hmm.
naloxone training. And I think what I love is the trainer is very gifted. His name is Dylan Dunn. He is our senior director for our Safe Campuses program. He put a program together that is accessible and it's usable and it's
Hmm.
educational and informative, but it's practical. And
Yep.
I think that's what people need is to recognize these are the steps in terms of potentially saving a life.
Hmm.
And when people watch those videos, the feedback I get, I can do that. It takes away a barrier. So
It does. It makes it less scary.
it makes it less
Absolutely.
scary.
Hmm.
And I remember the first time I was trained on naloxone, I was out with an EMS crew. They were advanced life support paramedics. And
Hmm.
I remember opening the naloxone, be prepared. They ended up administering it. And the second time they were like, hey, you be prepared. And even though I'd been trained, I hit the plunger and sprayed naloxone because my adrenaline was going. And the paramedics said, don't worry, go get more. We got plenty.
Right.
This happens a lot. You'll never forget now that you've experienced that. I was like, dang, that
Right.
is really sensitive. And I wasn't made to feel incompetent. I wasn't made to feel invalidated. I was equipped and empowered to learn from my mistake. And I made a commitment that's never going to happen again.
That's awesome. I mean, it would be great if we could get workplaces to start carrying naloxone on all their job sites for sure. I think there's a lot of question around how to get it now. So what does that look like?
Yeah. Unfortunately, there are federal and state grants
Hmm.
that in many places did not allow for the distribution to workplaces. The thought being those federal and state funds were going to be supporting harm reduction initiatives for the underserved populations,
Gotcha.
people without access to health
Hmm.
care, people without insurance and copay and deductible options, right? So the idea was workplaces have more insurance, they have more funding, they're
Mm.
for profit versus nonprofit. Let's fund the people with the free naloxone that can take care of people who need it the most
Yep.
in unhoused areas, in public
Sure.
health clinics. In the workplace, it is available as an over the counter medication. for as little as about $35. So for companies that are waiting for free naloxone, you're really valuing a human life potentially at $35. And no one would do that on mental health or suicide prevention. So we need
Or
to
health
think
and safety in general.
in general, a set of quality gloves, a set of
Hmm.
quality eyeglasses, the
A
cost of a
helmet versus a
safety
hard
mask.
hat. Hmm.
You think about it, we've converted from hard
Hmm.
hats to helmets. We've invested more. So having that preparedness is really the first step in changing the mindset. There have been some states that did have very generous grant programs that didn't exclude workplaces. But I'm encouraging people to learn the options. You can buy directly from the manufacturers.
It's good to
There are
know.
some nonprofits that have made themselves distributor choices. We do it as well for companies that need help and assistance. But I also know companies that are small and medium sized businesses that are going to a brand retailer, purchasing it or making an order, picking it up as a delivery. There's a lot of options. Don't let that lack of availability be a barrier. Contact someone like me. I'll help walk you through the process, give you some options that you can use. It really shouldn't stop us from doing the right thing.
Absolutely. So we've thrown around the term recovery friendly workplace a couple of times. What does that mean exactly, especially in relationship to the rest of the conversation we've been having? I know that it's easy to say, oh, we are, or we have recovery friendly options in place, or we have things like second chance agreements. So that makes us recovery friendly. Talk to me about all of that.
It's an interesting phrase.
Mm-hmm.
There have been three words bandied about. You've heard of in total worker health from
Yes.
NIOSH, the idea of workplace supported recovery. The federal government had a program that they called recovery ready workplaces. And then there is an institute for recovery friendly workplaces. The original state program was in New Hampshire. It dates to 2018. And it was that New Hampshire Recovery Friendly Workplace Initiative. It does appear to be the name of choice, but generally all three of those names are referring to the same thing. And it's an organizational culture with some policies, procedures, and protocols that are going to help support the needs for people with substance use and persons in recovery. It's going to have you build this culture and then have policies to support it that will take away stigma, create an environment feeling included, de-emphasize alcohol, de-emphasize the adverse consequences of a failure of a drug test that may be required by company policy. You use that term, a second chance agreement. It's
Mm-hmm.
hard when it's a DOT, safety sensitive regulated position,
Sure.
but giving employees the opportunity to self-disclose ahead of time without a termination or disciplinary action to say, okay, let's work through this together. It's going to require a culture change. It's going to require us to be a little more hands-on, still maintaining privacy and confidentiality, but helping that person navigate the care they need. Today, Sonya, that doesn't happen as well. It happens a little more reactively.
Okay. Yeah.
75% of employers tell me when I do surveys at presentations, usually for associations or for large groups, that they have programs for prevention, treatment, and recovery.
Mm-hmm.
When I ask them further, about 80% are reactive, and it's
Mm.
after one of five events. It's been a person's refusal to test, a failed drug test, a motor vehicle infraction in a company or a personal vehicle, a disciplinary action or a performance issue. So those are really two separate, but they could be the same.
Sure.
And the fifth has been they call off work because there's a medical or criminal justice matter relating to substance,
Mm.
sometimes mental health.
Mm-hmm.
So it could be, I can't come to work today. I've got a court matter. What's going on? How can we help you? Well, I was arrested for suspicion. It's going to show up on my motor vehicle record, but now I've got to adjudicate this. Or I was in a bar fight on Friday. Wasn't my fault. I just was defending myself, but I got a disorderly. And the third might be a domestic violence, right? So
Wow.
the others are, we had a health crisis. One of my children or my spouse or my partner needed support for mental health, suicide, or an overdose. And if at that point we haven't shared resources with people, giving them a referral and a handoff to an EAP, or here's the benefit number, it's a little late. They're already deep in the problem.
You're living it. Yeah.
Those resources are better if we do it up front. So if we have the conversation with all employees about recovery, about treatment options, about community resources, and we have personal relationships we can refer people to, 12-step programs, non-12-step programs, peer support programs, the county health, city health, it gives you an opportunity to become more conversant on how to help people with those conversations, because every conversation you have makes you better for the next one. So we wait, unfortunately, for a crisis, and then it's a 5-alarm fire, but we're not prepared. We didn't check our hoses. We didn't check the hydrant pressure. We didn't check if a truck was available to transport us to the burning building.
Sure.
And now a person or their family is at risk.
I know when I talk about suicide prevention in that space, the reason people aren't starting a lot of the time is because it's so overwhelming. They don't know where to start. They don't know what information is the right information. They don't know what conversation is the right conversation. So where does someone start in creating that recovery-friendly workplace or creating that recovery-friendly safe space?
We're working on a pretty cool project for Recovery and Prevention Month. The marketing team at Safe Project said, Cal, you know a lot of people. Do you think you could get some of your friends to do some glimpses on what is a recovery-friendly workplace? So I put an outline together. I did invite 9 individuals to share different snippets, and it was powerful. I saw a draft late last week. So I'm excited that we're moving forward, and you're going to hear some really cool voices of people describing what it means to them and the benefit it has and some of the tools and resources in the toolkit. But I think what's important, people wait sometimes for the perfect program. What we find is every scenario is different, and how can we support that employee requires flexibility. So don't wait for the perfect program. Learn about this, lean in, look for resources, reach out to Safe Project, look at the recovery stories we're sharing this month, look at the tools, join some of the webinars that we do throughout the year, but especially during Recovery and Prevention Week. Just because they're not workplace focused doesn't mean we can't learn from them.
It's always a
If
nugget.
anything, we're a little behind still in workplaces on the substance use. Our campuses team is advanced. They've been doing this work for the last 9 years, and they're far ahead in teaching people some of these tools and techniques. Look at what is happening with Recovery Week in New England since 2019. Most people across the country aren't aware of this. So I'm always championing that cause. That's been a powerful movement. Look at what ABC, the Associated Builders and Contractors, has done. They are a certified recovery-friendly workplace initiative, but they have been using total human health, and they've been addressing this idea of substance use. And I'll give a shout out to the AGC as well. Associated General Contractors of America has a mental health, substance use, and suicide prevention task force. So we're enlisting this army of helpers to start having those conversations. But Sonya, it requires leaders like you to say, we need to stop, put a spotlight on this, and do this work together. And that's what I love about the partnership that Safe Project has built with the Construction Industry Alliance for Suicide Prevention.
Us too. It's going to take more than just you and I. It's going to take more than just ABC and AGC. We all really have to. We say a lot that we are stronger when we lock arms, right? And the more that we can bring light to this conversation and the conversations around suicide prevention in construction as well, the closer we are to saving lives.
And Sonya, I was so grateful when you said, let's do that webinar, even though it was going to be in October. Mm-hmm. It was less crowded. It was less congested. It was a chance to focus.
Right.
And then I said, how do you want to do this? Who do you want to invite? And I gave you some options, and you you selected Dana Piscopo. Mm-hmm. She works with Oracle. She built a recovery-friendly workplace initiative. Mm-hmm. She is a co-chair of the National Recovery Institute. And a gentleman named Nick Williams, who had been a director of operations for a company in Colorado called Absolute Waterproofing. Mm-hmm. And now he is the association director for the American Subcontractors Association in Colorado. And both are persons in recovery. Both are passionate leaders in this space. Both can share their tips and tidbits. I think it's going to be a really, really fun webinar.
I am super excited for that conversation. That is going to be on October 15th. And just like Suicide Prevention Month, Recovery Month is not just a month-long conversation. They are both 12-month-a-year conversations. So October is the perfect time for us to put an individualized spotlight on that. And people will start seeing on our LinkedIn and on our website the opportunity to register for that webinar. So we're excited about that.
Thank you. I'm excited about that as well. We look at this as being an ongoing dialogue.
We do.
Not that one and done. And that's what I love about partnering with you.
Yeah, we're going to have lots more conversations about this. So I have one last question for you, Cal. And this is something we ask all of our podcast guests. And interestingly enough, you mentioned the word intentionality earlier. And I don't know if I've shared this with you, but that is actually my word of the year. So I have tried to be very intentional this year with our time, my time, with the voice of CIASP and what we are partnering with and saying and doing. And so I'm going to ask you, what is your word of the year?
It's funny because I anticipated that you might ask, because when I listen to the podcast, it's a question you seem to ask.
Everyone.
So Thank you. I was a little intentional about using the word intentionality because we're friends and we've been partners in this cause. So thanks for noticing. I think for me, I'm going to squeeze two words in. One is hope. I just believe hope is powerful. And if we can amplify hope, it will help people to eliminate that loneliness and give them a sense of people care and that connection. The second word is persistent, and it's been my word all year. My motto since I was age 27, I learned from a mentor, is gentle pressure, relentlessly applied. And sometimes I've used the word relentless as my word. I've never chosen the word persistent, but I wanted to reinforce this is a journey. This is going to have many steps. The mountain is steep, but together we can ascend to that peak and help people struggling with substance use, misuse, maybe addiction, and give them pathways to hope, help, and recovery.
Well, you are one of the most persistent people I know. And as we've all talked about in this space, we know that hope is the antidote. And so I hope that we can continue to keep pushing that.
So we're hopefully persistent. How's that?
We are intentionally, hopefully persistent.
Love that. Thanks for the conversation today, Sonya.
Thank you. Thanks, everyone. Have a great day.
Bye.
Bye-bye.